Ebola virus disease, also called EVD, is a rare but extremely serious illness that affects both humans and some animals. It is known for causing severe symptoms and can be life-threatening if not treated quickly. The virus was first discovered in 1976 near the Ebola River in what is now the Democratic Republic of Congo. This first outbreak marked the beginning of our understanding of this dangerous disease. Since then, there have been many outbreaks, mostly in Africa, affecting thousands of people and challenging local health systems. These outbreaks have taught us a lot about how the virus spreads and how to respond. Ebola can make people very sick, causing symptoms like fever, weakness, vomiting, and bleeding. In severe cases, it can even cause death, especially without proper medical care. Ebola is caused by a group of viruses known as the Ebola virus genus. These viruses are part of a larger family called Filoviridae, which are known for their long, thread-like shape. These viruses attack the human body's immune system, making it very hard to recover without medical help. Quick treatment and supportive care can improve the chances of survival. The disease can spread quickly in communities, especially where healthcare is limited and people live close together. This makes it important to act fast to stop the virus from spreading. Outbreaks often cause fear and confusion, as people worry about their health and the safety of their families. Misinformation can make the situation even worse. Ebola is not common in most parts of the world, and most people will never come into contact with the virus. However, it is important to stay informed, especially if traveling to affected areas. However, when it does appear, it is extremely dangerous and needs fast action from health workers and the community to prevent it from spreading further. Doctors, nurses, and scientists from around the world work together to control outbreaks, treat patients, and search for better ways to prevent and cure Ebola. Understanding Ebola and how it spreads can help prevent panic and reduce the risk of infection in communities. It also helps people know what to do to stay safe during an outbreak, such as practicing good hygiene, avoiding contact with sick individuals, and following health advice. Learning the facts and sharing accurate information is the first step in fighting Ebola and protecting yourself and your community. Ebola does not start in humans. The virus lives in wild animals, especially in some parts of Africa. The process of the virus moving from animals to humans is called spillover. Spillover happens when people come in close contact with infected animals or their body fluids. Usually people get Ebola by hunting, killing, or eating wild animals. Sometimes people find a dead animal in the forest and touch or eat it. If that animal has the Ebola virus, the person can become infected too. Spillover is rare, but it is the first step in every Ebola outbreak. Once one person is infected, the virus can then spread to others. This is why doctors warn against eating or handling wild animals, especially animals found dead. Stopping spillover is important. If we avoid unsafe contact with wild animals, we can prevent new Ebola outbreaks from starting. Scientists believe certain animals carry the Ebola virus without getting sick themselves. The main suspects are fruit bats. These bats are found in many African forests, and some eat fruit or nectar from trees. Fruit bats can carry the Ebola virus in their saliva, urine, or droppings. Other animals like monkeys, chimpanzees, and gorillas can also get Ebola from bats. These larger animals may get sick or die from the virus, just like humans do. Sometimes people become infected after touching, hunting, or eating these animals. Eating bushmeat, wild animal meat, is a risky practice, especially in areas where Ebola is known to exist. Bushmeat includes bats, monkeys, and antelopes. By understanding which animals can carry Ebola, people can make safer choices. Avoiding contact with these animals can help stop the virus before it reaches humans. After the first human gets Ebola from an animal, the virus can quickly begin to spread from person to person, often leading to outbreaks in communities. This usually happens when someone comes into close contact with an infected person, especially if they are caring for them or handling their belongings. The most common way Ebola spreads is through direct contact with the blood or body fluids of someone who is sick with the virus. Even a small amount of these fluids can carry enough virus to infect another person. Body fluids include not just blood, but also saliva, sweat, vomit, urine, feces, breast milk, or semen. These fluids can all contain the Ebola virus, especially when a person is showing symptoms. Touching objects or surfaces that have blood or body fluids on them can also spread the virus. This means that anything contaminated, like bedding, medical tools, or even doorknobs, can be a risk if not properly cleaned. This includes needles, medical equipment, or clothes used by a sick person. Sharing or reusing these items without proper sterilization can easily pass the virus to others. The Ebola virus can enter the body through broken skin, such as cuts or scrapes, or through the eyes, nose, or mouth. Even touching your face after contact with contaminated fluids can be dangerous. Caring for a sick person, especially without protective clothing, is very risky. Family members and caregivers are often exposed when they help with feeding, cleaning, or comforting the patient. Family members and health workers are at higher risk because they are often in close contact with patients and their body fluids. Without proper protection, the chances of infection increase significantly. People who help clean or bury the bodies of those who died from Ebola can also catch the virus if they are not careful. Traditional burial practices, which may involve washing or touching the body, can be especially dangerous if protective measures are not followed. Good hygiene and using protective gear are key to stopping the spread of Ebola. Wearing gloves, masks, and gowns, and cleaning hands and surfaces with disinfectant all help reduce the risk. Simple actions, like wearing gloves and washing hands thoroughly with soap and water, can make a big difference. These steps are essential for protecting yourself and others, and for stopping the virus from spreading further in the community. Many people worry that Ebola can spread through the air. This fear is understandable, especially when people see others wearing masks or hear stories about how dangerous the virus is. But let's take a closer look at what's really true. But this is not true. Ebola is not airborne. The virus does not float in the air or travel long distances from person to person. You cannot catch Ebola by breathing the same air as someone who is sick. Simply being in the same room or walking past someone with Ebola will not make you sick. The virus does not travel in droplets through the air like the flu or COVID-19. Those diseases can spread when someone coughs or sneezes, but Ebola works differently. You only get Ebola by touching infected blood or other body fluids, such as vomit, saliva, urine, or sweat. The virus enters the body through broken skin or mucous membranes. Sitting next to someone with Ebola will not make you sick unless you have close contact with their fluids. Everyday activities like sharing a bench or talking do not spread the virus. Shaking hands, hugging, or caring for people without protection carries a risk if they are showing symptoms. That's why healthcare workers wear special gear to stay safe. This fact is, honestly, very important. Knowing how Ebola really spreads can help everyone stay calm and take the right precautions. If people know that Ebola is not airborne, they are less likely to panic. Understanding the facts helps communities respond wisely instead of with fear. It also helps communities focus on real ways to stop Ebola, like washing hands, avoiding contact with sick people's fluids, and seeking medical help early. Understanding how Ebola spreads helps protect everyone. When people know the truth, they can take steps that really work to keep themselves and their families safe. Myths and rumors can make outbreaks worse, so knowing the truth is, well, absolutely vital. Sharing accurate information saves lives and helps stop Ebola in its tracks. Ebola symptoms, well, they actually start off a lot like many other common illnesses. In the early stage, people might have fever, headache, muscle pain, and a sore throat. These signs are usually pretty mild at first, but honestly, they can get worse quite quickly. After a few days, symptoms often become much more severe. People may have vomiting, diarrhea, stomach pain, and even a rash. As the disease gets worse, some folks might bleed from the nose, mouth, or eyes. Internal bleeding can also happen, which makes the illness really dangerous. Ebola makes people weak and very sick. Many patients need to stay in a hospital where doctors can keep a close watch on them. The risk of death is high, especially if people don't get medical care quickly. Knowing the symptoms helps people seek care early. Quick action can save lives and help stop the virus from spreading. The time between catching the virus and actually feeling sick is called the incubation period. For Ebola, this period is usually between 2 and 21 days. Most people start to show symptoms about 8 to 10 days after being exposed to the virus. During the incubation period, people don't feel sick at all. They also can't spread the virus to others. Ebola only spreads after symptoms begin. This is different from some other viruses, where people can be contagious before they even feel ill. It's really important to watch for symptoms if you've been near someone with Ebola or have traveled to an outbreak area. Quick action helps stop outbreaks from growing. Doctors use the incubation period to track close contacts, and this helps find new cases early and protect communities. Preventing Ebola is definitely possible with some basic steps. First, avoid any contact with blood or body fluids from anyone who is sick, especially if they have Ebola symptoms. Wash your hands often with soap and water, or use an alcohol-based hand gel. Don't eat or handle bushmeat, especially bats, monkeys, or animals found dead. It's important to avoid unsafe burials and funerals for people who died from Ebola. Only trained workers with proper protective gear should handle bodies. Healthcare workers need extra protection too. Using gloves, masks, and special clothing keeps them safe. Family members caring for the sick should also use gloves and avoid direct contact with fluids. Simple hygiene and safe practices really do save lives. Communities working together can stop Ebola from spreading. There is now a vaccine against Ebola. The vaccine helps protect health workers and people who have been in contact with Ebola patients. It's given in areas where outbreaks happen. The vaccine can't stop Ebola after infection, but it can prevent it before symptoms start. New treatments are also helping more people survive. Doctors use antiviral medicines that fight the virus. Supportive care like giving fluids, oxygen, and treating other infections is still very important. Early treatment really does improve survival. In the past, Ebola was almost always deadly. But today, with vaccines and better treatments, more people are surviving. Doctors and scientists are always working to find even better ways to fight the disease. Awareness, prevention, vaccines, and new treatments offer hope. Working together, the world is better prepared to stop Ebola outbreaks and save lives.